The Biden administration wants to do what?
You are now tuning in to TNJ Radio Show.
All right. What's good, everybody? Had to come in and make a quick video today. I actually came across this information a couple of days ago, but I wanted to just kind of vet it, check through a couple of different sources to see if it was real, because the initial source that I got it from was one that it might not have necessarily been very credible. So you know how it could be with the media. There are lots of things that are put out through phony websites. There's a lot of misinformation that goes on, and in today's day and age, you want to definitely be careful, but with what's being put out. But this, unfortunately, is real. What we have right now is the Biden administration is looking or is going to fund crack pipes, amongst other things, given out in the name of COVID relief. So we're going to get into it pretty soon. Hey, if you're watching from Facebook, if you're watching from YouTube, be sure to hit the like button. If you're watching from Facebook, be sure to go over to our YouTube at TNJ Radio. My name is William A. Thomas. I'm one of the hosts of TNJ Radio, where we give you the raw, real, and uncut. And subscribe. If you haven't subscribed, what are you doing? You're going to be missing out on all this good stuff. So let's get right into it. So there was an article that came out talking about how the Biden administration plans to deal with what's going on with the drug epidemic. Now, we have these different bills that go on. We have COVID relief bills that go on, and usually in them, there's a lot of stuff, and no one ever really reads them, which it kind of speaks to why it's really important to kind of shorten these things out. It shows why they don't ever have like a one or two page bill, because they're always looking to sneak in whatever they can. So, for example, anyone remember the HEROES Act? This was put out by Nancy Pelosi. And let me just show you guys some examples of some of the things that were in here. This was a COVID relief act that was for 2020, right? 2.2 trillion. I think it started out at 3.4 trillion. I'm not sure where it ended out at. But some of the things that included were the Butch Lewis and the GROW Act, which had nothing to do with COVID, elimination of the limit on state and local tax SALT deduction, nothing to do with COVID, 350 million to the Corporation for National and Community Service, nothing to do with COVID, 270 million for the National Endowment for the Arts and Humanities, which it's split 135 million for arts and 135 million for humanities. Nothing to do with COVID. So do you guys kind of get the picture what I'm saying in regards to a lot of these different bills? They pack things in there. You'll hear the term pork thrown around, and it's something that people who support either side of the aisle, if you support the Republicans, if you support the Democrats, if you are independent, whatever, you should always have a concern for this, because a lot of times what will happen is they'll look to use a crisis to be able to push forward things that they were looking to do in the first place. For example, even right now, we have the Cody crisis. Everybody knows what that means. And there have been a lot of things that were pushed in the name of protection, in the name of safety. And what we're finding out is that while some of those things may have been helpful, a lot of them have been proven to be harmful in the long run. So let's look at what's going on today. So our federal, in the name of harm reduction. Now, keep in mind that term, okay? Because this isn't actually new. The substance abuse arm of the Health and Human Services Agency will begin providing funds to help distribute safe smoking kits for the consumption of various illicit drugs like crack cocaine and crystal meth. So what they're essentially saying is, hey, if you're going to go and do the drugs, we want you to be able to do it safer, because if we could get you in a safe space to do it, then it might prevent crime, or it might prevent disease being passed on, and so on. Now, like I said, this isn't new. This actually goes back, and let me just get this on a screen so you guys can see this. Okay, 1 second. This goes back to a program that was going on in Seattle. Now, one of the things that ends up happening every time you hear people say about different things, like for years we were hearing about illegal immigrants being able to vote, and they said, no, that's not true. We heard about illegal immigrants being able to get benefits. No, that's not true. And, a lot of people, even looking at this, they're saying, well, this is just one of the many things. But a couple of days ago, they would have probably said, no, it's not true. But this started, in 2010 in Seattle. And basically, it says on here for more than 20 years. Let me just make this bigger so you guys can see it. Sorry about that. There we go. All right. I hope that's a little bit better. But it says that in a nondescript alley in the University District, people in Seattle, users can pick up clean crack pipes, pipe filters, ascorbic acid for injecting crack. Heroin users can also pick up a drug that reverses a heroin overdose, an apparent first for a city needle exchange. Now, just think about this. Whenever the government has historically, they go to try to quote unquote help these different causes. And that's where we end up with things like the war on drugs, the war on poverty, the war on crime. How did that end up resulting? What were the results that we ended up getting out of that? It ends up the same. We end up with things that end up a whole lot worse than the problem that was initially there. So the war on drugs, well, how did the drugs end up getting there in the first place? Now, I'm not saying that anyone who got the drugs, should have necessarily taken it or not taken it, but like those drugs in just fly themselves over here, and we've always had a customs process. So you do the math. A lot of the guns that were there in times past, how do you think they got there? As far as them helping the family, remember that program where they said, you know what, we'll give you some assistance, we'll give you a place to live real cheap, but you know what, you can't have a man living in the house. This is how the government quote unquote helps. And their quote unquote help usually ends up doing more destruction than the good that they suppose it's going to end up doing. But this is something that's been long planned in the making. Let me just let former President Obama tell you about it. Now listen to the wording he's using.
I have stated repeatedly, and it's actually reflected in our most recent statement by our Office of Drug Policy, that we need to have an approach that emphasizes prevention, treatment, a public health model for reducing drug use in our country. We've got to put more resources into that. We can't simply focus on interdiction because, frankly, no matter how good of a job we're doing when it comes to an interdiction approach, if there is high demand in this country for drugs, we are going to continue to see not only drug use, but also the violence associated with the drug trade.
So when you hear that, okay, to the untrained ear, all that you're hearing is more so, how are we going to, help with dealing with the issues of drugs that are going on the streets, which sounds good. Here's the question was asked, and you can actually find this in the White House archives. It was a speech to the University of Maryland on July 22nd, 2011. But the question was, all right, much sacrifice is being asked of our generation. So when are our economic perspectives going to be addressed? For example, when is the war on drugs and society going to be abandoned and replaced by a more sophisticated and cost-effective program of rehabilitation, such as the one in Portugal? So whenever they're talking about that, they're talking about that theory of harm reduction models, harm reduction theory, which is basically a theory that says that, hey, if the people are going to do this or that crime, why don't we provide a safe space for them to be able to do it, and with the hopes that whenever they do it, they're going to do it in a less destructive way. Now, let's just follow that rabbit hole a little bit further. So by this logic, could say, you know what, there are people that are going to do gun crimes. So what we're going to do is we're going to at least do the purge. The Purge, which it's a movie, is almost like an example of the harm reduction theory. The main thing of the Purge was that people have all this pent up anger and things like that, and what we can do is, by allowing a day where people will be able to go out and there's just lawlessness, and in hopes that during the other days people will be more in check. So I'm not sure if the writers of the Purge actually got it from harm reduction model, but it's a similar philosophy in mind. If we take it further, hey, people are going to, it's kind of like the wife that says, you know what, I don't want my husband to get a DUI. So what I'm going to do is I'm going to load the house up with booze and, just keep on feeding him the alcohol to his heart's content, with the hopes that he won't have to leave out and go to the bar. Now, we all know, whether, men or women, we know that a lot of times going to the bar doesn't really have to go with going to the bar, have to do with going to the bar. You're just more so trying to get some time out, of your situation. But I digress. The fact is that taxpayer dollars are going to be directed towards these type of things. I mean, it's already been done. It's in a previous, stimulus bill, basically. There are other things in there, and I'm pretty sure that a lot of it's going to come out, but it's not logical to say that we can't talk about the one thing without talking about it all, when no one really has it all. It takes a long time to be able to get it all. Read the tax code. The tax code, no one really knows everything that's in the tax code. The thing's like 3,000 pages long. And that's why they do it like that, because they know that people won't read these things. And most of the people who are in politics, the politicians, these are lawyers, and most of them don't read it. Anyone remember before they did the Healthcare Reform Act, one of the things that was said about it, hey, we need to just get this in and we'll find out what's in it later. Wasn't that some genius wording? So, yes, there should be an outrage in regards to this because I don't want my taxpayer dollars, going towards funding this type of stuff. I don't, and I'm pretty sure that a lot of you right now, we're in the twilight zone. It doesn't matter where you sit. If you're a Democrat, Republican, independent, you need to voice your opinion. Like a lot of people are walking around sleep because of who they supported or who they supported in the past. We have to be able to get past that and to be able to look at the reality of right now, our country is being ruined. It's getting driven into the ground. And if we don't do something now, I always say, and my co-host Laron J, we always say that we have a country to save. There won't be a country to save long. So with that, that's just a short sip of T and J. You guys have a great day. Peace.